I want to just note that we are moving forward in the Health Committee on a very important markup next week on a mental health bill that Senator Cassidy and I have been working on for over a year, and we frankly hope that that will eventually find its way to the floor of the Senate and in some measure be a very partial answer, but an answer nonetheless to this epidemic of gun violence. We hope that we'll be able to have that debate this year. But I would also note that we have in the Health Committee that is, I think, a very important complement to the discussion we're having right now on the opioid crisis all across the country. As my colleagues know, there is a limit on the number of patients that providers can prescribe buprenorphine, which is really the most effective, least addictive of the heroin substitutes. As a physician, you can only take 100 clients to prescribe this drug, and if you're a physician assistant or a nurse practitioner, you're not allowed to prescribe. And in Connecticut, that's the biggest obstacle we have, is we just don't have enough physicians who can prescribe this very effective drug. And the TREAT Act, which is a bipartisan bill, removes that cap for physicians and allows for nurses with higher levels of training and PAs to prescribe that drug as well. I would hope that the Health Committee will take up this bill as part of our markup next week. If it was up to me, we would include it as part of our mental health initiative and move it to the floor and block. The CARA bill is really important this week, but let's be honest, there's no money in it. So there's a bunch of new programs, but no new resources for us in Connecticut to try to take on this fight. If we were to pass the TREAT Act next week in the Health Committee and move it to the floor, that would be real, tangible relief for communities in Connecticut. It would mean more addicts coming out of detox would have access to true elements of recovery, in particular this very effective drug. And so I'm hopeful that the Health Committee will move on this bill next week, that we can bring it to the floor, perhaps as part of this broader mental health package, and in one fell swoop we can have some partial answer to the epidemic of gun violence that plagues this country, and passage of the TREAT Act, or a version of it that frankly by itself might actually be more substantive than anything in the piece of legislation that's before us today.